There we go. All right. Hello, everyone. Welcome to Partners in Prevention and LGBTQI's summer webinar series. We're very excited about this one today, and I am going to pass it over to Elvis, who's going to talk about mental health and LGBTQIA community. Please enjoy. Elvis, passing it over to you.
Awesome. Thank you so much, Ryan. Good morning, everyone, and thank you so much for joining us today. As Ryan mentioned, my name is Elvis Guiracocha. I will be your facilitator for this afternoon session. And essentially, today's webinar will be touching base on mental health and the LGBTQI plus community. Before we get started, I'd love to start with an introduction on who I am and some of the work that drove me to social work in general. My pronouns are he, him, his. I am a proud Latinx, queer, activist, survivor, and social worker who has dedicated his career to uplifting and supporting our LGBTQIA plus community of color who reside throughout northern New Jersey. Being first generation US born, my passion for social work, advocacy, and creating affirming spaces that are inclusive of one's own intersectional identity by using my own family's narrative of navigating various systems as simple Latinos living in the US in the early 80s. And as a person reclaiming space and promoting physical, mental, and emotional well-being, I am so happy and thrilled to be your facilitator with you today. A little background as to where I currently work. I am the Community Health Programs Manager for the Hudson Pride Center. We are Hudson County's largest LGBTQ plus agency and community-based organization. We serve all of New Jersey residents, specifically Hudson County folks seeking health and supportive services. I'm responsible for the implementation and oversight of all health-related programs, including but not limited to the HIV prevention and also transgender health programs at Hudson Pride Center. I've earned my MSW, my Master's in Social Work degree from the Graduate School of Social Work over at Rutgers University, and my field of expertise in both LGBTQ+ studies and women and gender studies throughout my academic career has heavily influenced the work that I set forth with the center and my career overall. So this is just a little brief introduction of who I am, so you guys can get a little feel for who's facilitating your training today. Simple community agreement. Before any training or webinar that I usually facilitate, I love to run through a little agreement between participants. Please be mindful and be present of the webinar and everyone's time. Actively participate, ask questions. Feel free to reflect on your own experiences throughout today's webinar. Be respectful of others' experiences as well. It's important to understand that my experience may differ from everyone else's within the community. It's not linear, so it's important to just be mindful that others may have different experiences than you. Let's all seek to maintain a growth mindset, and let's most importantly, stay rooted in respect throughout the webinar. I encourage everyone to ask questions, take notes, and feel free to share your feelings as to what resonated with you at the completion of today's webinar. Community garden. So usually in live presentations, I love to kind of introduce what a community garden is and what this kind of looks like. So essentially outside of the community guidelines that we all just went through, if there's anything that any participant wants to kind of share with us to put into this community garden, something that you need to set for your own personal boundary throughout today's webinar, please include this in today's community garden. I will note that there will be sensitive topics that we might touch on when we talk about mental health, specifically within our LGBTQI plus community. Themes around suicide and suicide risk is prevalent amongst this webinar. So I just do want to disclose that trigger warning in case anybody needs some space and wants to debrief a little after. I'm more than happy to do that with you as well. Okay, so a couple objectives before we get started. So at the end of today's session, participants will be able to gain knowledge on important risk factors of LGBTQIA plus mental health. So specific risk factors that kind of put our community at risk for mental health issues, as well as needs for mental health resources. And the second objective is mental health as it relates to our LGBTQIA plus community through an intersectional lens. So kind of diving into the intersectionality within our community and how that relates to our mental health and overall emotional well-being. Our third objective for today is to talk on a little bit about support for LGBTQIA plus mental health. So ways in which allies can support members who are within our community or friends or colleagues in the workplace as well. And our last objective for today's webinar is to touch on important mental health resources for our LGBTQIA plus community. Okay. So Firstly, before we talk on anything related to our community as well as mental health, I think it's important to talk on intersectionality and what this essentially is. A lot of times this might be a phrase that has just been recently introduced to folks on this webinar. So I just wanted to provide some clarity as to what intersectionality is and why this is so important and prevalent when we talk about mental health. So intersectionality is the concept that we are all made up of multiple identity characteristics that essentially make us who we are, right? So we all have different layers of different identities that essentially come together to create unique forms of privilege and oppression, depending on our community and how we identify as. So it's important to understand that intersectionality is just a simple framework that encompasses different layers of a person's identity. And because of that, it sheds light to the unique forms of either privilege or oppression that specific subcommunities experience due to their different layers of identities. So I did list a couple examples. So that can include race, gender, socioeconomic status, sexual orientation, religion, and so forth. And these are just a little examples of what intersectionality can look like. It is multifaceted, different layers. It's important to kind of dive into intersectionality when we talk about our community, because our community is encompassed by different layers of different identities, different sexual orientations, different gender identities, different races, different socioeconomic backgrounds. So with this understanding of how intersectionality is defined can really help us in guiding us through this webinar to understand the complex theories behind, intersectionality and the way it relates to mental health and overall disparities when it comes to seeking resources that can alleviate our mental health and overall emotional well-being. The next slide I wanted to talk on today was about SOGI. So if you're not familiar with this phrase SOGI, essentially what this stands for is sexual orientation, gender identity, gender expression. Everyone has a SOGI status, and this looks completely different depending on where you are, where you're located, and how you choose to identify. So it's important to understand that sexual orientation, gender identity, gender expression, these are three different layers that make up a person's SOGI status. So understanding that a person's sexual orientation can differ from a person's gender identity. These things are not mutually exclusive. So it's also important to know that, gender expression, just as much as sexual orientation, those two can differ depending on how a person chooses to express their gender. So it's important to kind of differentiate these two terms when it comes to sexual orientation as well as gender identity in order to fully understand the complexity when it comes to understanding a person's SOGI status. So sexual orientation can encompass examples like being gay, bisexual, pansexual, for example, lesbian. Gender identities can range from a multiple of different identities such as non-binary, man or woman, for examples. And the gender expression can, differentiate depending on a person's choice. So a person can choose to identify their gender to be a man, but can express their gender to be more feminine, and that is okay. So it's just important to understand and dissect these different layers of SOGI so that we can fully understand our community, our LGBT+ community, and how this relates to our community specifically. So understanding LGBTQI+ identity is continued. So sexual orientation, gender identity are both core components of a person's identity, as I mentioned. These are not mental or physical disorders requiring intervention to change. It's important to kind of take a look back at history. A lot of times clinicians reference the DSM, which is a diagnostic manual that can help aid clinicians in order to provide diagnosis for clients that they're treating. In 1973, the American Psychiatric Association actually declassified homosexuality as a mental illness. So once upon a time, the DSM-2, which we're currently at the DSM-5 from my understanding, but the DSM-2 earlier, a couple decades ago, did consider homosexuality as a mental illness. Yet transgender individuals can still be diagnosed with a mental health condition called gender dysphoria. And this is still prevalent within the current DSM-5 that clinicians use to reference in order to make diagnosis. And this diagnosis of gender dysphoria is kind of important to touch on as well, because it allows clinicians to provide access, to allow their clients to provide access to a health insurance covered route in order to receive trans-affirming physical care, such as hormone replacement therapy, gender-affirming surgeries. So a diagnosis is needed in terms when we talk about insurance claims. So this is why gender dysphoria, I believe, is still prevalent amongst the DSM-5. And I know clinicians have different opinions and different perspectives when it comes to this diagnosis. But from the general understanding understanding, it's important to kind of include background as to, how far we've come in terms of diagnosis as a society. So now, however, it took until 1992 before the World Health Organization actually declassified homosexuality in their ICD-10, and then until 2019 before the World Health Organization acknowledged that being transgender is not actually a mental health condition and would cease classifying transgender health issues as mental behavioral disorders. Currently, all major US mental health associations actually recognize that being LGBTQ+ inherently poses no obstacle to leading happy, healthy, and productive lives, and thus do not need fixing. One's level of acceptance of an LGBTQ+ identity by self or others is actually the key factor predictive of whether an LGBTQ+ person's mental health status might be linked to their sexuality versus other factors as predisposition, family dynamics, trauma, social forces, etc. And later on throughout this webinar, we're going to talk a little bit about how acceptance plays a pivotal role when we talk about protective factors in terms of mental health for our LGBTQ+ community. So this is just a little background in terms of being able to understand and differentiate the differences between both sexual orientation, gender identity, and how it relates to the DSM that clinicians currently use to provide diagnosis for our community members. This is pretty much a visual that encompasses different LGBTQ+ identities. And a lot of times it's important to kind of recognize that this is ever evolving. So what you see in your screen now may differ a year, 2 years, maybe 10 years from now. But currently where we stand in 2023, this is a pretty general list of different identities that are encompassed within our community. So we have lesbian, gay, bisexual, transgender, transsexual, queer, questioning, intersex, ally, asexual, pansexual, and all of these differ depending on the person's sexual orientation and their overall identity within our community. So this is also important to note that the terminology transsexual is actually listed here not as a phrase for you to commonly use. It's actually an outdated term that is actually reserved for the medical community in terms of making diagnosis. However, as a society, we've refrained from using this terminology when addressing our transgender community. So I just wanted to highlight there because I know you will see the term transsexual. It's actually an outdated term that is no longer used within our community. I also wanted to touch on a little bit about pronouns. So many of you who may be hearing pronouns for the first time may not be familiar with what this is. Everyone may use different pronouns based on their gender identity. So a person who identifies as male, for example, might use pronouns he, him, his. A person who identifies as females might use pronouns she, her, hers. And a person who identifies as non-binary may opt to use they, them, theirs as their pronouns. So it's important to note that pronouns are very important as clinicians, as also service providers, to be able to have an understanding as to why the importance of pronouns is really essential in terms of building rapport and making your space an affirming space for our community members. A lot of times it's important to not assume pronouns because of the act of misgendering. So on this slide, we talk a little bit about misgendering, how that kind of looks like. So misgendering essentially is what we refer to using a word or specifically a pronoun or form of address that does not correctly reflect the gender in which a person identifies with. So that's why it's always important to ask a person for their pronouns before assuming their pronouns. Oftentimes what we do is provide our own pronouns first when we introduce ourselves to clients for the first time. That kind of helps sets the tone as to what an affirming space actually looks like and what an affirming dialogue would look like with social rights agency, for example. So oftentimes when we introduce ourselves with clients with our own pronouns, it allows them the opportunity and autonomy to provide their own pronouns so that we have a mutual understanding as to how we should reference and identify each other within the space that we're sharing. It's important to know when misgendering does occur. The best way to handle it is just to simply apologize and just try harder next time. Keep the apology brief. Just say simple, I'm sorry, I meant, and use the correct pronoun. Keep the apology brief so that it doesn't become a lot about you and what the mistake you made. And just understand that, it's a quick scenario in which you're able to apologize briefly and just keep it brief so it doesn't take away from that person's lived experience and doesn't make it more so about you. So when misgendering does happen, keep it apology simple, keep it brief, and just correct yourself or ask that person to provide you with the corrected pronoun in which they are using. Some tips to avoid misgendering. Number one, please do not make any assumptions when meeting clients and community members for the first time. It's important to ask them the name that they go by or use. So oftentimes, if you don't have the opportunity to ask for someone's pronouns, you can ask them for their name first and then use that until you're able to kind of further build rapport with them and actually uncover what their pronouns are. You can also opt to use the pronoun they until you know what pronouns they use. Oftentimes, this might be the safest route in terms of not being able to, not wanting to assume someone's pronouns. So using the they, them pronoun until you actually get confirmation as to what their pronouns are may be the safest route in order to avoid misgendering. Some people introduce themselves with their pronouns first, as I mentioned, and you can offer yours when you introduce yourself as a way to kind of set the tone and further build rapport in the affirming space in which the client is coming to you for. And lastly, it's okay if some people are confused when you ask for their pronouns. I know oftentimes as generations go by, this is something that has been reintroduced. So oftentimes people who might not be up to date with our community as well as terminology and ways in which to avoid misgendering, they may not be aware of this. So you can tell them that it's simply your agency practice to do so. So that you can be able to further assess and understand what that person's pronouns are in order to avoid misgendering within the workplace or any community space that you find yourself in. So what is mental health? Mental health includes our overall emotional, psychological, and social well-being. It affects how we think, how we feel, how we act, and it also helps determine how we cope with stress or how we relate to others, and overall how we make healthy choices for ourselves in our day-to-day lives. Mental health can look different for a plethora of people. Mental health looks different depending on the person and the experiences and the lived experiences that they go through. It's important at every stage of life, starting from childhood to adolescence and all the way through adulthood. A study showed that more than 1 in 5 adults living in the US actually currently live with a mental illness. So it's pretty safe to say that maybe somebody you know, whether within your workplace or within a space that you share with somebody, at least one person within that space is experiencing some form of mental issues and illness overall. Another study showed that over 1 in 5 youth, ages 13 to 18, either currently or at some point during their lives, have had seriously debilitating mental illness. So these studies are important to kind of shed light as to, what mental health looks like and how it is pivotal and vivid within the community that we're currently working with. And specifically looking at it through a global lens within this country. These are statistics straight from the CDC. So it's important to note that mental health overall is a common theme throughout our society, and being able to differentiate these statistics allows us to kind of, illustrate how important mental health is and how common it actually is, as many may not even be able to normalize these conversations. It's actually very, very vivid within the communities that we share with one another. Some key facts to share with you all. So the Trevor Project actually has an amazing study in which they conducted surveys among LGBTQI plus young people. So the first key facts that it's important to know when it's related to mental health is that nearly 1 in 3 LGBTQI plus young people said that their mental health was poor, either most of the time or always, due to anti-LGBTQI plus policies and legislation. I know that currently now in the year 2023, we're living in a political climate in which different states throughout the country are proposing different anti-queer bills and policies to kind of eliminate our existence within society. So the Trevor Project took lead and took initiative with surveying young people and how this correlates to their mental health. So it's important to kind of shed light on the vivid reality that our community is experiencing nationwide, and how as a result of these policies, how it's affecting the mental health within our LGBTQI plus young people community. In addition to this, nearly 2 in 3 LGBTQI plus young people said that hearing about potential state or local laws banning people from discussing LGBTQI plus people at schools made their mental health actually a lot worse. So in the state of New Jersey, we actually have legislation that actually promotes LGBTQ plus history within the school districts. That's not the case nationwide. So it's important to note that, depending on the state in which a person within our community lives in, can determine how they're treated and how they're viewed and what services, to the extent that they're able to access within their jurisdictions. So a lot of times we see states like Florida, states like Tennessee, for example, that are actually proposing these laws that are trying to erase our community and our history within schools. And as a result, is making their mental health a lot actually worse. The last statistic that I wanted to share for this webinar is that actually 41% of LGBTQIA plus young people seriously considered attempting either suicide in the past year, and young people who are actually transgender, non-binary, and or people of color reported higher rates than their peers. So it's serious and actually crucial information to kind of highlight within this webinar to kind of understand, the extremity as to how mental health plays a significant role within our community, specifically amongst young LGBTQI plus young people. And depending if you are transgender, non-binary, people of color, these are intersecting identities that actually report higher rates of mental health and suicide attempt among the community as a whole. So essentially, overall, these key facts are really, really essential in terms of being able to fully understand the significance mental health has on LGBTQ plus community, as specifically young people, and when we talk about suicide attempt, ideation, and risk. Some important risk factors of LGBTQI mental health. As I mentioned before, these are some of the risk factors that I wanted to touch on for today's webinar. So coming out, coming out looks different for our community members depending on our family system, our socioeconomic background, and so forth, cultural factors, a lot of factors that come into play when it comes to coming out. It's shown that positive changes in actual acceptance of LGBTQ plus people act as a protective factor for mental health. However, this shift in acceptance has meant that many LGBTQ plus young people come out or share their sexual orientation, gender identity at younger developmental ages, which can actually impact their societal experiences and relationships as a whole. This can have a negative mental health impact if a person is either rejected through their coming out phases, and also particularly for youth who are not in supportive environments. So for LGBTQI plus youth who are residing in homes that are not affirming, who have cultural barriers, religious barriers that prevent them from being able to explore and understand their identity within a whole, makes coming out as one important risk factor for our community's mental health overall. And similarly, we talk a little bit about rejection. And for many of the LGBT plus community, coming out can actually be difficult or even a traumatic experience. So being able to hold space for that, understanding that, not everyone has that privilege of being able to come out in a safe and affirming environment. It can be difficult to cope with rejection of something as personal as one's own identity from either their own family or close friends, within the workplace, or within a religious or faith community. So rejection can definitely look very different and complex according to a person's identity. We talk a little bit about trauma within this webinar as well. So when we talk about trauma related to homophobia, biphobia, transphobia, bullying, these are common themes within our community members that experience when trying to navigate their own identities within heteronormative institutions, right? So a lot of times we may see LGBT plus youth being bullied in schools for their identities, not being able to kind of express their identities in the way they choose. So they have to kind of stay hidden, stay closeted, and pretty much minimize their own identities in order to be accepted in the society that they live in, right? So we can kind of see how trauma in this sense, such as also stereotyping, labeling, denial of overall opportunities because of their LGBTQ identity, can definitely impact their mental health. The LGBT community is actually one of the most targeted communities by perpetrators and hate crimes overall in this country. So when we talk about themes such as discrimination, a lot of these things can contribute to significantly heightened risk for PTSD among individuals within the LGBT community compared to those who identify as heterosexual or cisgender as well. So it's really important to kind of see how trauma plays a very strong role as a risk factor when we talk about mental health within our LGBTQI plus community. In addition to this, we talk a little bit about substance misuse, right? So substance misuse may be used as actually a coping mechanism for a lot of our community members, or a way of self-medicating for LGBTQ plus people experiencing mental health concerns. LGBTQ plus adults are actually nearly twice as likely than their heterosexual counterparts to experience a substance use disorder. Transgender individuals are almost 4 times as likely as cisgender individuals to experience a substance use disorder within their lifetimes. And overall, studies show that illicit drug use is significantly higher in high school age youth who identify as LGBTQ+, or who are unsure of their identity compared to their heterosexual peers. So we can kind of see how important and significant substance misuse is within our community, and how this plays as an important risk factor when we talk about mental health access and overall concerns within our community as a whole. Homelessness is definitely another theme that can pose a risk factor for mental health within our community. It's actually estimated that LGBTQI plus youth and young adults have 120% higher risk of experiencing homelessness within their lifetimes compared to their heterosexual counterparts, oftentimes due as a result of family rejection, discrimination based on their gender or sexual orientation. This risk is specifically higher among Black and Native American, Alaskan and Native LGBTQ plus youth. Many members of the LGBTQ plus community face the added challenge of finding homeless shelters that will accept them. So it's one thing to find a homeless shelter, but it's also another thing to find a homeless shelter that is affirming and will be able to provide an inclusive experience for you regardless of your sexual or gender identity. A lot of times in these spaces, LGBTQ plus people who are experiencing homelessness may be confronted with elevated rates of either harassment, discrimination, or overall abuse within these spaces when attempting to seek homeless shelters, for example. It's important to also touch on inadequate mental health care. So oftentimes we talk about how mental health is very important for everyone, regardless of your gender or sexual orientation. But for our community specifically, there are different disparities and different barriers that present a challenge for our community in terms of being able to access this. So a lot of times, identity factors that include race, socioeconomic status can affect the quality of care that they receive or the overall ability to even access care. So oftentimes we see challenges with being able to access insurance coverage for either undocumented LGBTQ plus folks that are not able to access state Medicaid insurance, or LGBTQ plus people who are confronted with homelessness or are from a disadvantaged socioeconomic background, not able to afford the high rates that mental health clinicians actually do charge if you don't have insurance access, right? So it's important to kind of shed light on how inadequate mental health care can actually be for our community members as a whole. Lastly, suicide is also an important risk factor to touch on when we talk about LGBTQI plus mental health. Oftentimes, our community members are struggling in silence, right? And face one of the worst health outcomes as a result. So the LGBT plus community is actually at a higher risk than their heterosexual counterparts for suicidal thoughts or suicidal attempts. There was a study that showed that actually 40% of transgender adults have attempted suicide within their lifetime, compared to less than 5% of the general US population. So it's important to kind of see suicide and see how significant it plays a role as a risk factor for our community in terms of being able to, one, understand their own mental health, and two, to be able to actually explore resources that is accessible and also affirming for our community members to seek. So a lot of these factors that we touched on right now is really essential and important and significant when we talk about our community members and what are risk factors at play that contribute to the mental health to our community members. Okay, and I want to play a short video. This video is very important because it talks about coming out and their lived experiences within our LGBTQI plus diverse community, specifically within our Latinx community as a whole. So I'm going to play this video. It's about 5 minutes long, and then we could talk a little bit about it after.
Yeah, a gay man.
This meeting is being recorded.
I'm Sebastian, I'm from Chile, and I'm a gay man.
My name is Curly, I'm Salvadorian American, and I'm a gay man.
My name is Helen, I'm Salvadorian, and I'm a lesbian.
My name is Florencia Garcia, I was born in Buenos Aires, Argentina. I'm queer.
The first time that I came out, I was 18 years old.
I was 11 years old.
I was like 21, probably when I was like 12 or 13 years old. For a long time, I identified as bisexual. I felt like it was easier than saying I was like a lesbian.
So I came out when I was living in Chicago with my dad. We're all from Argentina, and my dad's from a very small town. And me coming out was not like it was an accident.
I had no intentions of coming out.
I came out to my sister. I was like, I need to talk to you, I need to tell you something. I was super nervous. I didn't know how to tell her. And then she's like, all right, like, I'm all yours, like, what's going on?
My dad decided to check the history of all the websites that I had been searching. So when he had seen me looking for Brad Pitt's dick, it became a thing. And then they asked me if I was in fact gay.
I went to Pride. I snuck out of my house. We get there and it's like amazing and it's really hot and sunny, so I get a like sunburn or whatever. And I go home. I lived at my parents' house still, and my mom walked to my room and threw my door open, and she was like, "¿A dónde estabas?"
Back in the day, there was something called the party line, and they had a gay and lesbian area. And I ran up the bill, and my dad found out what the party line was. And at the time, I was talking to some girl. I don't remember her name. I just know it started with a J. And I carved out her initial in my fingers, and he saw the number that I was calling and it had her name. And so like he put two and two together. He was like, does that J stand for Jessica or something? I don't remember her name, but he was like, does it stand for her? And I was like, yeah, it does.
She like gave me a paper and a pen, and she's like, if you can say it, just write it. So I wrote like, I'm gay. I gave it to her. And before she read it, she told me, I know what you're gonna say. And she just gave me a hug, and it was like fully supportive, and it was great.
I came out as bisexual, and I was crying, and it was a whole big thing. My mother hugged me, and they have made it very clear to me that they love me for everything that I am, everything that I'm not. They're just here to be my parents.
So she kept asking me, so I snapped. And I turned around from my desk and I was like, I was at Pride. And she got really quiet and she said, why? And that's when I was like, okay, well, I'm just gonna do it. And I said, because I'm a lesbian. I was like, Mom, I'm a lesbian. And she looked at me and she was like, no, you're not.
And that's how I came out, and he was not happy about it. At first, my dad was like not cool with it at all. Like, it just wasn't okay. Me and my dad didn't talk about me being, lesbian forever, it felt like.
Years went by, and it wasn't until my mom was diagnosed with end-stage lung cancer that she came anywhere near accepting who I was. So they basically told her, you have like weeks to live. And my dad told her, you're gonna get over this, you're gonna get over it now. Because you don't have time. You don't have any time left. She passed away in January of 2011. And a month later, I'm sitting with my dad in my apartment, and he says, your mom one night toward the end had looked over at me and said, I messed up. And she was like, I lost so much time with her, and I can't get it back. There was nothing we could do. Time had effectively run out. Probably like a month after the conversation that she had with my dad, she passed away.
So it wasn't until recently that my dad opened up, or at least acknowledged my sexuality. And it was after what happened in Orlando at Post nightclub, and I was in Canada at the time. And he texted me, he said, hey Flo, are you back from Canada? I came back from Switzerland to the horrible news of the mass shooting in Orlando. I'm appalled by the senseless act of hate of violence towards the LGBT community. This is absolutely crazy. And like him even like acknowledging the LGBT community was like, I had never heard him say that. And I like bust into tears when I read that. I was like, sorry.
Being who you are, regardless of what your mom or your dad or your siblings thinks, is the most liberating feeling. Because at the end of the day, you have to love you. You really have to love who you are and the way that you live your life. And if you don't, if you're living it for somebody else, you're going to end up mad at them, you're going to end up mad at yourself, and no one's going to win.
If it feels like it's dangerous for you to come out, I think that definitely be aware of your circumstances. It's understandable that not all of us can come out. Coming out really is a luxury.
I feel like you have to create your safety first, your own bubble.
Do your best in your own bubble. Do your best to be as much of yourself as you can in the world that you're in.
But if you live in a place where you genuinely would be accepted, I say, do it.
And we love you, and we're with you, and you're not alone.
Okay, awesome. So I really wanted to highlight that video because it really helps paint the narrative, right, as to how coming out really looks like for our LGBTQ plus community, and their overall experiences. You can tell that, depending on a person's cultural, race or socioeconomic status, coming out can actually look a lot different, and it's a very multifaceted experience when we talk about coming out within our community. So I'm going to share my screen again. Hopefully it works this time, and we can continue with where we left off. Okay. And the common theme within that video is acceptance, right? And I mentioned earlier on within this webinar that acceptance will play a strong, significant role when we talk about protective factors for our community members when they experience mental health concerns. So acceptance and overall support from parents and peers, particularly when it comes to sexual orientation and gender identity, serves as a protective factor for mental health. However, the shift in acceptance has meant that many LGBTQI+ youth who do come out or share their sexual orientation and gender identity at a younger developmental age can actually, which can actually impact their social experiences and relationships throughout their life course. Oftentimes we see youth who are coming out now at earlier ages in terms of those earlier developmental stages. So it's important to kind of see that as we progress as a society, how the shift in being able to accept our community within our family systems has been allowing our community members to come out sooner than what we've seen historically. Within school institutions, for example, there has been Gay Straight Alliances, also known as GSAs, which are overall student-led clubs that can provide an accepting and supportive environment for students to support each other around issues related to their sexual orientation and gender identity. At Hudson Pride Center, we offer assistance with those GSAs, helping build those workshops up so that youth within those school institutions have the opportunity to kind of be able to relate on one another and being able to lean on each other for community support within their school institutions. Also, parent engagement and overall family acceptance has been linked to positive health outcomes for sexual and gender minority youth. So parents who are accepting and affirming of their child's LGBTQ+ identity and accepting in terms of their overall gender identity as well has been linked to promote positive health outcomes related to physical, emotional, and mental well-being when it comes to our sexual and gender minority youth. It's a study by the Charter Project also did show that having at least one accepting adult can actually reduce the risk of a suicide attempt among LGBTQI+ youth by 40%. So that statistic is really important when we talk about acceptance, because we can see how significant acceptance is when and how it can serve as a protective factor for youth who are either experiencing suicide ideation or actual attempt for suicide. So having at least one accepting adult within the youth's life course can significantly impact and positively influence the way they understand and navigate their own mental health. Suicide. So this video touches on a little bit about our LGBT+ community and mental health. So I'm going to do the same thing I did last time. It's a short 5-minute video, and then we'll get started.
35% of LGBTQ youth seriously considered attempting suicide in 2021. That's according to a survey from the Trevor Project, a nonprofit providing crisis support for LGBTQ youth. The organization says it's the third consecutive year that rates of suicidal ideation have increased among LGBTQ youth. For more, Amit Paley joins me now. He's the CEO and Executive Director for the Trevor Project. Amit, thank you so much for joining us.
Thank you for having me.
So what were some of the other key findings of this survey?
Well, the findings overall have a lot of very disturbing and frankly heartbreaking news. We've seen over the past few years an upward trend in not just suicidal ideation, but also anxiety and depression among LGBTQ young people. And we see even higher numbers among transgender and non-binary young people and LGBTQ youth of color. And of course, this upward trend, which is very disturbing and upsetting, coincides with a lot of challenging things going on in the world with COVID-19 impacting the mental health of LGBTQ youth, as well as an increasing number of legislative attacks on LGBTQ young people, and especially transgender and non-binary young people.
Now, the survey also mentions that 60% of LGBTQ youth who wanted mental health care in the past year were not able to get it. So what are some of the challenges these young people are facing in gaining access to this care?
Well, in this country, we have, frankly, a broken healthcare system, and especially as it relates to mental health care. For so many people, especially young people, it can be really difficult to acknowledge that you need help and to be brave enough and confident enough to reach out for that help. And what we unfortunately found was that a majority of young people who finally felt the ability and the desire to reach out and get that mental health care couldn't access it. That could be because they were not able to reach mental health care providers. We have a shortage of mental health care providers in this country. It could be because they weren't able to afford it. It could be because they were not able to find culturally competent care. We don't have nearly enough clinicians and other mental health care providers in this country who know how to appropriately serve LGBTQ young people, who know how to serve youth of color and other groups that are particularly high risk.
So what more can the government do to provide better protection and representation of LGBTQ youth?
Well, there is a lot that can be done. Unfortunately, we are seeing in many places in this country governments and lawmakers taking, in fact, the wrong steps, taking steps that are harming LGBTQ young people. We need to have more access to mental health care. That is critical. So many young people need and deserve that, and as we just talked about, can't access it. We need the government and people in positions of power to be providing affirming spaces and making sure that they are acting from a place of love and support. Unfortunately, we are seeing state after state taking steps that are harming LGBTQ young people. We've seen states that are trying to prevent trans young people from being able to access the mental health care that their doctors and parents support. We're seeing states and governments trying to prevent trans young people from being able to use the restroom that corresponds with their gender identity or play on sports teams with their parents. And we are seeing government officials trying to ban schools and educators from being able to talk about LGBTQ issues. All these things we know can reduce the risk of suicide if we lead from a place of love and affirmation and acceptance.
What resources would you recommend for LGBTQ youth who may be struggling with their mental health right now?
Well, first of all, LGBTQ young people can always reach out to the Trevor Project. We are available 24/7 with free and confidential support. You can reach a trained counselor via phone, text, or chat, and we have lots of resources on our website. But we also hope that we can get more adults to be coming from a place of support. And that requires adults to step up and to make sure that they are leading from a place of love and acceptance. One of the most powerful pieces of research we have at the Trevor Project is that having just one accepting adult in an LGBTQ young person's life can reduce their risk of suicide by 40%. 40%. That's a huge difference. And I hope everyone watching and listening to this knows you can be that person. Just by being loving and accepting and supportive and being there for LGBTQ young people, you can help reduce their risk of suicide and help save lives.
All right, Amit Paley, important information. Thank you so much for joining us.
Thank you for having me.
Okay, so that video really highlights and encompasses the themes that we were just talking about when it comes to challenges related to LGBTQI mental health and suicide risk overall, and overall challenges in terms of our community being able to navigate these resources, right? So oftentimes we heard in the video, LGBTQ plus individuals who want mental health may not be able to access it as easily as one may think. So I really, really love that video because it really does encompass the overall themes that we're trying to touch on within this webinar. Navigating mental health care within our community. The approach of sexual orientation, gender identity, and mental health care can often group together anyone in the LGBTQI community when these communities are considered at all. This method can also be problematic as each community within our LGBTQI plus community is diverse and faces unique challenges and rates of mental illness and experiences. The LGBTQI plus community encompasses a wide range of individuals with separate and overlapping challenges regarding their mental health. So other identity factors including race, socioeconomic status can also affect the quality of care that these individuals receive or their ability to access care at all. Additionally, members of this community may face harassment or lack of cultural competency from potential providers. So if a person is able to access mental health resources from a therapist, oftentimes they're confronted with a therapist who might not be affirming of their identity or culturally competent to be able to work with them in the way that they are seeking. These experiences can often lead to a fear of disclosing their sexual orientation, gender identity, due to potential fears of being discrimination and provider bias. So oftentimes you might see this common theme when our community members are simply looking to access overall medical care or overall mental health care or even job employment. A lot of these are vivid actual fears within our community. So when they are confronted with providers who are not as accepting or not as affirming or understanding of their identities, we can often see how this plays a role for our community members and their hesitancy around being able to access these resources as easily. Confronting these barriers and mental health symptoms with an LGBTQIA inclusive mental health provider can actually lead to better outcomes and ultimately recovery. So I know as a nation, we're currently experiencing a shortage of mental health providers, in addition to a mental health provider who's LGBTQIA plus affirming. So this is something that, on a national level, countrywide that we're experiencing. However, I know it's something that the Trevor Project has worked diligently with. So, I will be posting at the end of this presentation some resources that will be supportive and helpful for our community members in terms of being able to access and address their mental health overall. Overall support for LGBTQI plus mental health, first talking to someone you trust. It might feel hard to start talking about how you're feeling. I know oftentimes being able to speak freely or being able to be in a space where you're able to kind of hold yourself accountable for how you feel is very difficult for many of us within our community. So first step would be to finding someone you trust. If someone you trust is not available, there are definitely resources such as the Trevor Project's 24/7 hotline that you can reach out to speak to somebody. Also peer support, so being able to navigate through making connections with people who are having similar experiences as you can often lead to better health outcomes as well. So being able to find a local GSA, a local LGBTQ+ community center with support groups can often lead to better health outcomes for our community and our overall mental health and well-being. Self-care is the big one, and it's one of my favorite themes to touch on. It's important that as individuals who are experiencing a lot of this mental health, either disparities or challenges overall, it's important to hold space for ourselves in order to be able to fully function in the way that we expect ourselves to. Oftentimes we are either on autopilot, not able to kind of function in the way that we are, and oftentimes that's due to burnout, not being able to, hold space for ourselves to actually self-care. So self-care can look different to anybody. It can look the same to most, but oftentimes this is pretty much allowing yourself to provide yourself care for yourself, whether that's related to going outdoors, going for a walk, going on a hike, eating healthy, getting your hair done, getting your nails done. Those are just simple acts of self-care that one can practice and show themselves so that they're able to, help support their own mental health and well-being. Also asking your own primary care provider for help. Oftentimes we might not know where to start, and folks who do have insurance and have an actual provider that they can meet with regularly, at least once a year, asking them for help or guidance or referrals can be the first step that you can take as well. Working with a therapist, if that's something that's easily accessible to you, that's something that can definitely help and support overall mental health and well-being. And also understanding your legal rights, understanding that in this country, in the US, it's illegal for anyone to discriminate, any providers to discriminate, providing services to you based on your sexual orientation or gender identity. So understanding that you have a legal right to access these resources just as anyone else. And obviously I will be posting resources at the end so that we can reference in the case that we do need this for future referrals. Supporting our LGBTQ community. So as people who have family members or who have coworkers who are within our community, first step is don't make assumptions. Don't assume a person's identity. Do not assume someone's pronouns. It's important to listen to their experiences, listen to what they're telling you, listen to what they're allowing to disclose to you so that you can be able to fully understand and address that person in the way that they want you to. Show them that you care, show them simple acts that, you're here to listen. You might not understand fully exactly what it is that they're going through, but you are at least there to listen and show them that you care. Support them to seek help if needed. So if you have a coworker, a family member, a friend, somebody that you really know that is in need of mental health support, encourage them to seek help, encourage them to seek out resources to fully overall enhance their mental health and well-being. Also, do your due diligence. Make sure you read about LGBTQIA+ issues, become up to date with different terminologies, different issues that our community members are experiencing. As years go by, challenges become more pivotal and more apparent. So it's important to become cognizant of the current issues that are currently impacting our community, and doing the continuing education on our end to be able to fully work with our clients in an affirming way. Also learn more about their mental health needs. Every individual experiences mental health, and that looks different depending on their lived experiences. So if they allow you to learn more about their mental health needs, then I would encourage you to be there for them and to listen to their experiences, and show them that you care, so that you can be able to fully understand and learn more about their needs overall when it comes to their mental health. And lastly, take care of yourself. I know firsthand that putting others before you can take a strong toll on your own self-care and your own mental health. So it's important to also take care of yourself throughout this process, and when you are supporting somebody within our community, because you won't be able to help somebody in the full way that you're expecting yourself to if you're not 100% able in the mental capacity to do that. And lastly, this is a slide with a list of mental health resources for our community, with direct links to each. And a lot of these resources are available virtually online, so it's easily accessible for our community members to access. So when you are supporting somebody to seek services or overall assistance when it comes to their mental health, these are definitely a great list of resources for you to reference. And lastly, I will close with any questions, any comments, any concerns, and I would take that at this time. Thank you so much for everyone's time and cooperation and patience and being able to work with us today. It was a privilege to be in this space with you, to be able to facilitate the education and knowledge around mental health in our overall LGBTQ+ community. I look forward to working with you on. If there's any questions, I'll make sure to get my email and contact information if there's any follow-up needs that are needed. Thank you so much, and have a great and wonderful day, everyone.